Welcome back to our channel, the Medcom, based in Makerere University, Uganda. Today with me is actually I'm called Ria Hania.
And Dr. Men.
Dr. Men. Today we are, first of all, we appreciate and welcome everyone who was in second year to third year, and actually third year is easy, according to you.
Yes, according to me, I think third year is an interesting year, and it's a year actually I call it a chilling year. There's more chilling in third year than anywhere. There's a lot of politics in third year, which is very interesting.
Interesting.
Yes.
Yeah. So today we came to actually tell you about what do you need to go with, because there are rumors going around that actually you need maybe a fetoscope, maybe you need an ultrasound scan. Today we are coming to tell you actually what do you need. Starting with, I think we should start with internal medicine. What did you need?
Yeah, this is generally what you need. So whatever I will mention in internal medicine, you may also use it in surgery and in pediatrics. So you need a stethoscope.
Stethoscope.
Get your best stethoscope, get used to it, because it's not good for you to borrow a stethoscope on the day of the long case or on the day of an OSCE, which you don't know how to use. So get a good one, either Litman 2, Litman 3, or Wandege scope, so long as it is what.
But be specific. Some words they will chase you. For example, you can't go with a Wandoscope on
Wandege scope on cardio.
On GI word of Professor Kajim. So you have to be also selective in what you are using.
Get a good stethoscope. 2, you need a thermometer. Okay. 3, you are going to need a tape measure. 4, you are going to need a tendon reflex hammer.
Especially those on neuro.
Those on neuro.
They will chase you without it.
You need what you call a patella hammer, the one used for hitting people's knees.
Yeah.
Then you are going to need.
For those on IDI, they need a mark tape.
Yeah, for those on IDI, you need a mark tape because you need to monitor those ISS patients to see the weight gain.
Of course, we are making assumption that every medical student has a watch. Because taking respiratory rate, taking heart rate, you need a watch.
You need a watch.
Then
another thing I've forgotten is the pen torch.
The pen torch.
Pen torch for pupillary light reflexes.
You shouldn't be having a phone. You shouldn't be using a phone.
A phone, to see the patient's eye. You see, the light of the phone is too much.
Yeah.
So make sure you have one.
Yeah, you need actually a sphygmomanometer, if that's the correct pronunciation.
Yeah, a BP cuff if you want. BP cuff and then the sphygmomanometer.
I know you don't know the pronunciation.
Yeah, that is one for measuring blood pressure. However, some people have an automatic one.
Yeah.
Yeah, so you can buy the automatic one where you just press, or this other manual one. But some old professors would want a manual one.
Of course, we are making assumption that you have your pen, you have your notebook. Yeah. Otherwise, they will chase you from what? Because if I ask you a question and you don't know why you're, what will show me that actually you are serious, you want to go and search it.
You have to go back. So that is the internal medicine what they need. So
I think what is now going to pediatrics.
So in pediatrics, you need the same thermometer, you need the same stethoscope, but you need a mark tape. Pediatric mark tape. Of course, they are for different.
Of course, even if the stethoscope also differs from the adults to the young ones.
Yeah, but if you have your big one, you can't buy it twice. So the one you have will work.
They usually have 2 spares. You can actually disconnect and connect it. You didn't know that.
Yeah. You see, I didn't know
I have
that.
Now, what else do you need in pediatrics?
So in pediatrics, you need a mark tape. Still, you shall need a tape measure. You are going to need a thermometer and all those. Actually, pediatrics and internal medicine, you almost need the same thing.
That is medicine.
Yeah, that is medicine. You need
we are making assumption that you actually at least you have like 3 clinical courts, because today you are going there, tomorrow you are going back. You shouldn't go with the what and watch clinical court.
Yes.
And that's why I come and tell you actually we have Rehania Attire.
Rehania Attire will have you sorted with.
We will go in actually in Kawempe, that is obstetrics gynecology.
Now in obstetrics and gynecology, still what you have in internal medicine and pediatrics will work for you in Kawempe, but the only differing thing in Kawempe will be what some people may need. This thing.
Fetoscope.
It's called a
fetoscope.
Actually, it's called a penile stethoscope.
Oh,
you didn't know it's not a fetoscope.
Yeah.
So you need a penile stethoscope if at all. But however, they are there on the cubicles. So you may buy one or you may use that same one. I think that is the only thing. You don't need an ultrasound machine.
Yeah, you don't need it.
You don't need a Doppler for digital heart rate and all those. You don't need gloves, all those will be provided.
Gloves?
Yeah, gloves.
It's better as a medical student to already have your gloves.
Yeah, but you can have your pair, by the way. In Kawempe, if you are assisting, they may not allow you to use the patient's gloves, so make sure you have your own pair of gloves. If at all you want to learn to.
You know, they have already told us we are going to surgery, so we are becoming surgeons. We have to cut here and there. So are we buying the biological sets? I don't know if they are called like that, going in surgery. What do you need in surgery?
Also, in surgery, the instrument need to be sterile. And so every instrument.
Do I buy them as a student?
No, you don't need to buy any instrument as a student. But still, you remember, they tell you there is no internal medicine patient, there is no obstetrics and gynecology patient. So a patient is taken as a patient. So whatever you do in internal medicine is the same thing you're going to do on a surgery patient. You're going to examine system by system, so you need all those equipment. Don't forget scrubs in surgery and obstetrics and gynecology. You need scrubs to go to theater.
At least you need 2 pairs of scrubs. If today you were in a theater, you shouldn't go back with those scrubs.
Yeah.
Why?
Yeah, because of want infection prevention.
I thought you don't know it.
No. Very, very important.
I think for today we are going to stop there, and then we shall remind you to subscribe, like,
and then share.
What about HEC? What is HEC? I've always heard it.
HEC is Higher Education Consult, and at HEC we do training for mature age entry exams. We do training for diploma entry. So please check out our contacts. We have materials for all the different programs.
I think that's not for medical students.
Yeah, that's not for medical students, but medical students have their friends who want to join medical school. Yeah,
I think that's good.
Yeah.
See you next time.
See you next time. Bye.